Hi everyone, Marta Berglund with 13 News Now here. Thanks so much for joining us on the 13 News Now Plus streaming app. It's been 5 years since World Health officials classified COVID-19 as a pandemic. Millions of people were sickened by the disease. Millions of people died. Now, for those of you who may have contracted COVID-19, you likely recovered after a few days, maybe a week. But for millions of Americans, that's not the case. Over 16 million people in the United States have suffered from long COVID, according to the U.S. Department of Health and Human Services. We heard from Rachel Beale. She's a Southampton County mom of 3 who's been forced to stop working due to the effects of long COVID. We heard her story, and we heard from doctors who are looking for a cure for long COVID. Here's our full interview with Rachel Beale.
Rachel, just tell me a little bit about yourself, your family, how long you've been in the area, what you do or did for work, just general biographical information.
Okay. I've lived in this area for about 20 years. I moved out here because my husband is from here. Before I got sick, I was in human resources, so I was a human resources director for Camp Community College. I loved my job. I loved my career, so it was really devastating to me when I had to stop working.
So you're not working?
No, I haven't. Since I got sick, I've just never recovered from COVID, and then was diagnosed with long COVID and just was never able to get back to work. Even though I kept trying over and over, and my doctor just kept taking me out of work.
Talk to me about, or take me back to the day that you remember thinking or being diagnosed with COVID. When was that? And how did you know you had COVID-19?
So I tested positive for COVID on March 17th, 2021. And I know that date because so much in my life has changed from that point. I knew I had COVID. I felt terrible. I had, high fevers and body aches, and I went to a clinic and got the test done. So I knew what was happening. I was sick like that for 2 weeks, and then I had gone to the doctor and I just wasn't recovering, and I was really frustrated because I'd already missed 2 weeks of work, and here the doctor's taking me out for another 2 weeks, and then it went on like that, and then it was like a month and so on, and yeah.
So it was fever. Did you have the classic COVID, like lost taste and smell?
No, I didn't have that. I had taste and smell the whole time, but for me it was really high fevers, like 103, 104, and then the body aches. It was excruciating pain. I've never felt anything like that before.
Did you, if it was 2021, by then COVID had been around for a year, did you know people who had it, who had any experience with the illness or anything like that?
I knew plenty of people that had COVID, but I had not heard of anybody having long COVID. I had heard a little bit about it in the news, but there really wasn't much information about it.
So take me back to when you were diagnosed with long COVID. When did it start to set in, like, this is not normal, this is lasting way more or way longer than a regular case of COVID-19?
When I was about 3 months in after COVID, let me say that differently. After about 3 months, that's when my doctor diagnosed me with long COVID. And I had no idea then that it would last 4 years. I could have never predicted that. I just, I hated that I was sick and hated that I couldn't do all the things I wanted to do. So I was very focused on trying to get back, I kept trying to push myself to do the things that I used to do, and that just made things worse.
Was it, the same severity of symptoms throughout that 3 months, or did it change and evolve? Or?
No, so after the acute infection, the main symptom I had was just fatigue. It was just, I couldn't do anything, and I was out of breath, and I wasn't so much in pain then, but I wasn't myself. I couldn't do much of anything without being extremely tired. And those symptoms with the shortness of breath, those were kind of my main symptoms in those first few months. I did have some pain in my stomach, and I ended up having to have my gallbladder removed because it was so inflamed from COVID that, I had to have the surgery.
So if you took a COVID test today, would it come up negative? Is it just the symptoms last, or how does that work?
So I'm not contagious, and if I did take a COVID test, it would be negative because I don't have like the active, I don't know, like where's my doctor? Like I don't have the virus, COVID virus in me like when you first get COVID. But some of the research says it's like the spike protein is still in my body, still in my cells, and that's what causes the inflammation and all the symptoms.
So 4 years down the line, is it still the same sort of main symptom of fatigue, or what is a regular day for you like with long COVID?
So over the years, I've had symptoms go away. I've had new symptoms. I've had symptoms that went away, return. Right now, my biggest problems are still the fatigue. That never leaves me. But I also have really bad joint and muscle pain. And I have a lot of POTS symptoms. So that's being really dizzy, very low blood pressure, nausea. It's no fun.
Yeah. Landon, as her son, what have you kind of observed about your mom over the past, when she first got COVID and how things progressed?
Well, I've seen like a really big decrease in energy. Like before COVID, she had a lot of energy. We were always doing a bunch of fun stuff. But then she got COVID, and then long COVID came, and then we haven't really done much big things anymore. Like, there are days where she wants to do fun stuff, but she can't really do it because her energy levels are just plummeted, just low. And there are some days where she still does not have the energy, but she still wants to go out and do fun stuff. And I have to remind her that, like, if you do this, you will crash. Like, if you do this, the next couple of days is going to be dreary, and, she's not going to be able to do much at all.
Mm-hmm. Those are terms, we hear a lot of, is the base and the crash. Can you kind of explain what that is in terms of long COVID?
Like when she crashes is when she's overly exhausted, and so sometimes she gets exhausted just by doing simple things. She could drive me up to school and back, and she would get exhausted after doing that, and she would have to spend the rest of the day either resting or just trying to get herself prepared for the next day.
Mm-hmm. And so, Rachel, what is your base? Would you say you're at your base right now? I sometimes hear people are their base is being in bed. What is yours?
My base is probably like a day like today. I am tired, but I have enough energy to do the few things that I need to do today. But I'm also planning my nap. I nap every day, and first thing when I get up in the morning, I start planning when I can lay back down.
So with an interview like this, is this going to cause you to crash?
Definitely, yes. When this is over, I'm gonna most likely lay down on the couch, and I'll be done for at least a few hours. I won't want to do anything, and then hopefully this evening I'll be able to move around a little bit and spend time with my family. Long COVID is so unpredictable. I don't know from one day to the next how I'm gonna feel.
So with that being said, why did you feel the need to partake in this if it is going to exhaust you so much?
It's very important to me to advocate for long COVID. There's 17 million Americans that have long COVID, and there just isn't a lot of information about the illness. And, that bothers me because the pandemic might be over, but the 17 million Americans that have long COVID, it's not over for us because we're still sick. We're still fighting. We're still struggling. We're still trying to figure out, what's going to happen with us down the road with this illness. I don't remember the second part of your question. It's very important for me to spread awareness about long COVID. There's 17 million Americans that are sick with long COVID, and nobody's speaking up for us. So we have. I am going to speak up at every opportunity.
Do you think people are aware of long COVID's existence, the severity of it? I mean, the situation that millions of people are in?
I can tell you the first couple years I was sick, nobody knew what long COVID was. And that was really frustrating, going to doctor's appointments and, them saying long COVID's not real or it's just depression and anxiety. That was really frustrating until I started going to the long COVID clinic at Norfolk Centera. That's when I started having a little bit of hope in my situation, because there are treatments that help with the symptoms, but there isn't a cure. There isn't any magic pill for us. There isn't even a protocol of medicine for us to take. Every person with long COVID, it's so individual.
How does that make you feel emotionally, to kind of be like, this is completely uncharted territory?
I try not to think about what's down the road for me. It's scary. I have symptoms, like I said, I have symptoms that I didn't have before. So just in the last 6 months, I've been diagnosed with asthma. And the other day I had my first asthma attack, and that was really scary. So to me, it feels like it's not getting better. So what is that going to be in 6 months? I don't know.
When I went to the Centera support group, it was interesting watching people kind of put in the chat what it's like having long COVID, not just physically, but emotionally. It seems to be exhausting. Can you kind of elaborate on that?
Long COVID has pretty much taken over my life and my family's life. I don't like to think too much about having long COVID because it's overwhelming for me. So when I'm getting ready to, attend an event and speak about my experience with long COVID, it's very emotional for me because I'm talking about every symptom and, how it feels and how it's impacting my life. And if I sat here today and just started listing all the things that have happened, I would be in tears. It's very emotional. It's very depressing. It's life altering.
Mm-hmm. Landon, what has it been like for you to have to watch your mom go through this and go through this as a family?
It's very sad. And so I really miss how active she used to be. Like I mentioned before, she was a very active person, and now she can't really do much anymore. And so I really have to take care of her now. Like, I run a lot of errands and stuff for her, and so like I go get her prescription, go to the grocery store, and stuff like that. But it's really sad for me because she's our mother. She's supposed to be out there doing mom things, but she can't do that.
And you mentioned, when you first were trying to work through this, you kept pushing yourself and pushing yourself. Is that out of like anger or guilt? I mean, I'm the kind of person when I'm sick, I'm like, why am I not better? I'm mad at myself.
Yeah, yes. So for me, before I had COVID, I was really healthy. I worked out on my lunch break. I didn't even have any medicine. I wasn't even on any prescription medicine at that point. I'm sorry. It's called brain fog. What were you asking me?
Did you feel any sort of, when he says, I miss that she was active, is there any guilt associated with that? Or
Okay, yeah. So after the first couple months of being sick, I felt terrible as a mom because I wasn't doing my normal stuff. I wasn't doing the normal things in the house, like cooking and laundry and things like that. I wasn't able to attend events that the kids were having at school. And as a mom, it just made me feel like I was a burden more than anything.
Mm-hmm. Did you guys kind of have to work through understanding you know, she literally cannot do this, or how did that kind of work itself out?
It took me a little while to fully understand it, because to me it was almost like just like flipping a switch. Went from very active to just not being able to do much.
Yeah.
So it took me a while to fully understand it.
Rachel, you mentioned you feel like long COVID patients are being forgotten. In what way? By other people, by the government, by doctors? How so?
I think a lot of people in the long COVID community, including myself, feel forgotten because you just don't hear about long COVID in the news anymore. And, you know, I feel like the research has paused a little bit because of the change in administration, and that's very scary for me. I do feel like the cure is near. I feel like the research is almost there. But if we have to stop because of politics, then that's scary for me.
Mm-hmm. I'm curious, have doctors said anything to you? I've seen a little bit of discourse about this, like having the vaccine versus not, before and after. Were you vaccinated before? Were you vaccinated after? Were you not? Did that affect you at all?
So for me, the vaccine wasn't available yet for me. If you remember in the beginning, they had different classes or levels of who could get it, and I was like in the third class.
Sure.
So I was waiting for my turn. So I wasn't I didn't have the vaccine in the beginning. And then I was diagnosed with long COVID like 3 months later. And it was about 6 months later that I did get vaccinated. And, you know, one of the things that I do want to mention, there's been some recent posts on social media saying that the vaccine causes long COVID. And I was very upset when I saw that because it's not the case. I mean, that wasn't the case for me. And I you know, it made me very fearful that people would not get the vaccine now. But you can still get COVID. And the more times you get COVID, the greater your chances are of getting long COVID. And people need to know that. I don't want anybody to have to go through what I've gone through.
Have doctors given you any sort of reasoning as to why you? I mean, it feels like people of all ages, all health, all, you know, genders get long COVID. Did they say, you know, you were susceptible to it because of this, or is it just random?
No, I didn't have any health conditions before I got sick, and I was very active. So there isn't. That's the thing about long COVID is it doesn't matter who you are. It doesn't matter how old you are. It doesn't matter if you were active or not before. Anybody can get long COVID.
What is your treatment like? I mean, I know you go to Centera's long COVID clinic. Is that a monthly thing, a weekly thing? How does that work?
I see a lot of different specialists. I have my PCP. I go to the long COVID clinic. I have a neurologist, a hematologist. There's probably a few more that I'm not remembering right at the moment. And I usually see them about every 3 months, unless something has come up and I need to see them sooner. But it's usually every 3 months.
Landon, what does your family have to do in terms of caregiving? I know she mentioned she has medication. Is it mostly just doing errands and other things, or are you involved also in her medical care at all?
It's mostly just doing errands and stuff, but there have been times before where she would have doctor's appointments and I would take her to and from her doctor's appointments and I would be there with her. And yeah.
Mm-hmm. Yeah, that makes sense. For both of you, it's been 5 years since the pandemic hit. I guess it's been 4 years since you got COVID. What are you hopeful for in the next few years?
I want a cure. I'm waiting for the cure. You know, there are treatments, but they treat the symptoms. And I want the treatment that's going to cure me. I don't think I'll ever be who I was before as far as my health, but I do hope and feel like there's going to be this point where I'm not as sick as I am and that I have more energy.
Yeah, I'm also hoping for a cure too, but I'm also hoping that hopefully within like the next year or so, like some of her major symptoms that really bother her will start decreasing, and she will eventually start getting better within the near time.
How many hours would you say you sleep a day? I'm just curious. Like,
I sleep a lot.
Yeah.
It depends. It depends on so many things. If I don't have anything to do or I don't have to be anywhere, I could sleep. I could do like a 2-hour nap in the morning and then take a 2-hour nap in the evening and then go to bed and get more sleep. But if I'm in a crash where, you know, I've done too much and I've crashed, I sleep and rest the entire day. I don't move from the couch or the bed. I can't do anything.
yeah, and I'm sure I mean, times like today where you're like, I'm just gonna have to be okay with crashing. What is that like?
So for me, certain things, I know I'm gonna crash after, like when I advocate and you know, I'm speaking up and I'm at an event and I have to get prepared for it, and sometimes I have to, you know, drive. So all of that contributes to wearing me out, and I know I'm gonna crash, but that's part of it. And I don't even care that I'm going to crash. It's more important for me to speak up because somebody has to know about us. So I just know what's going to happen and I just deal with it.
I think you mentioned when you testified with the Senate, was it like 6 days that you crashed, or what was that?
Yes. So last year I was asked to share my testimony at a Senate committee hearing. And I knew I was going to crash hard. I wasn't feeling that great even before we went. And I remember telling my husband, I don't think I can do this. And he said, you have to do it. You have to speak up. You know, having that opportunity, you know, I have to do it. So I testified, and immediately after, so while I was testifying, after about an hour in, I was ready to leave the room. I was already starting to crash. I could feel it. My body was very achy, and you know, I was ready to be done. And then when it was over and I could leave the room, my husband had to help me walk out of the room. And I went into a conference room and tried to lay down.
Mm-hmm. Yeah. So I mean,
It was immediate. And I mean, I've had there was another event in DC that I participated in on the Washington Post Live, and I crashed before I even got out of DC.
mm-hmm. Yeah. I'm curious about the mental health aspect of this, because I know you mentioned a lot of people with long COVID have anxiety and depression because of just the looming future ahead. What has the toll been on your mental health over the past few years?
So, let me think about how to say this. Anxiety and depression are symptoms of long COVID. The anxiety and depression was not there before I got sick, and for me, it's been very difficult. I'm in therapy. I have a therapist that I see, that I've been seeing pretty much this whole time. I have moments where I'm really depressed because I can't do what I used to do, and I feel like my family deserves, you know, a mom that can, you know, be active with them. So it's hard. It's really hard not to spiral down with the depression.
I mean, has your family had to, or have they experienced any of the effects of that as well? Have you guys struggled with anxious thoughts, depressed thoughts, kind of looking at the situation, Landon?
I don't believe so.
Mm-hmm.
I mean, I know I haven't, but I don't think my brother and sister or anybody else in the family has experienced that.
She's asking how it affects you.
I mean, I know you said it's sad.
Mm-hmm.
Obviously, it being sad and being depressed are different, but does the weight of it, I guess, weigh on you guys?
It does. I mean, it does make me feel anxious because like, I wonder, like, what will the next symptoms be that come in, and like, how will that affect her? Yeah.
When did you make the decision to step back from working, like, officially? Or was that an official decision?
I did not make that decision. I was out of work for about 6 months, and that was the end of my short-term disability. And as the HR director, I knew what the policies were, and I knew that if I couldn't come back to work at that 6-month point, that I would be separated from my job, that I would no longer be working. And when that time came, I felt like, even though I hoped that I was going to get better, and I really wanted to get back to my job and just get back to everything I was before, but I knew that I was holding my employer back because they didn't have an HR person, and I just had to give in to my health and just step back and focus on my health.
Mm-hmm. Yeah. Is there anything else you think I've missed asking you to, or that you want to specifically mention?
Are you interviewing Dr. Chow?
Mm-hmm.
So he'll probably talk about like the IV, like the trials, the clinical trials.
Yeah, and I'm also speaking with a woman who's doing the trials. Are you also part of them or not?
Monday I have an appointment to go do the lab work to see if I qualify for one of the trials. So I'm very hopeful that I get to be in that trial. It's for IVIG, and it's that's medicine that is used for people that have extreme autoimmune disorders, and I think that might be one of the best treatments for long COVID right now.
Mm-hmm. What has being able to, go to the long COVID clinic done for you specifically?
My first appointment at the long COVID clinic, Dr. Chow spent over an hour listening to me and writing down my symptoms, and it was very validating to have a doctor that knew 100% what I was talking about, and I didn't have to prove that I was sick or prove that I had these symptoms. He just believed me, and that was tremendous. And throughout the last 2 years that I've been going there, anytime there's a new treatment or something new that might work, he offers that to me.
Mm-hmm. But you mentioned to us you don't want to just be taking medications to mitigate.
Yeah, so there are some medications out there that do help treat long COVID, and a lot of people are finding a lot of success with them. But for me, I don't like taking medicine, and I definitely don't want to take medicine long term. So when those options have been offered to me, I've ultimately turned them down because I want a cure. I want something that's going to go to the root cause, and these other medications are just helping manage the symptoms. There are some things that I do have to take. I have to take medicine for my heart. I'm on inhalers. I have to use oxygen at night. So I have medicine that I have to take, but if it were my choice, I wouldn't be taking any of that.
For more information on long COVID, including another patient's perspective and the perspective of a doctor at Sentara working to find a cure through clinical trials and other treatments, you can visit this story on 13newsnow.com. For 13 News Now, I'm Marta Berglund.